The urgent advisory that went out to the nation's nursing homes from the National Center for Assisted Living calls for immediate new infection control measures, including prohibiting visits by sick family members and to work with families on alternate ways to visit their family members, like Skype, phone calls, and email. The new guidance also asks nursing homes to monitor your staff and visitors for following hand washing or use of alcohol hand gels, review plans for cohorting residents in the same room or wing to prevent the spread to other residents and staff, and remind staff, contractors, and volunteers to stay home if they are sick. The association says it is also reported to the U.S. Centers for Disease Control that nursing homes are having trouble accessing types of personal protective equipment such as masks and gowns due to the worldwide shortage. Maryland's Governor Larry Hogan has also ordered the health department here in this state to immediately coordinate with nursing homes to review and reiterate guidance on infection control and medical management. Among the most cited violations, according to federal data, are the basics, including the failure to wash hands, wear protective gear, and employees who continue to come to work even though they're sick because they don't get sick day benefits. Scott Broom, WUSA 9.